everybody. My name is Ava. My pronouns are she, her, and I'm a community organizer at Iowa Citizens for Community Improvement. And today we're going live from the Iowa State Capitol, where doctors from around the state are calling on the governor for a statewide face covering policy. Iowa CCI is a grassroots membership organization with nearly 5,000 members across the state. And our members organize day in and day out on different social justice issues, from clean water to healthcare, racial justice, climate justice, and getting big money out of politics. And when the COVID-19 pandemic hit Iowa, we saw very quickly that the health of all of us is dependent on the health of our most vulnerable populations. And so that's why Iowa CCI members across the state are calling on Governor Reynolds for a statewide face covering policy. And nearly 6,000 Iowans have signed our petition at staysafeiowa.org, calling on the governor for just that. What we've seen from the governor since the pandemic hit is that she's continuously put the interests of corporations and businesses above the lives of everyday Iowans. So from the meat packing plants, where she had workers continue to go to work, continue to do production, even though there were massive outbreaks at these plants that we're continuing to hear more and more about, she continued to have those workers go in and put their lives at risk for those corporate profits. And now we see the same thing happening with schools, right? So mandating that schools go back at least 50% in person, when teachers, janitors, school administrators, all of the staff that really work to help educate children at these schools are saying that it's too soon, that they're not seeing what they need, and that they need to be able to have control over what's happening. And I think the thing that is really important to understand is that these numbers, these lines on the stats, they're not just numbers and figures on a chart, right? These are actual Iowans, everyday people whose lives have been lost because of COVID-19. And so today, nearly 300 doctors across the state are also calling on Governor Reynolds for a statewide face covering policy. And in just a second, they're going to start a press conference here at the Capitol that we're going to be live streaming to you all. So stay tuned, like and share this video so lots and lots of people see it. And we're going to head up there now so we can hear what they have to say to Governor Reynolds.
Good morning. My name is Austin Babe, and I'm an internal medicine physician here in Des Moines. And standing behind me are physicians and medical professionals from across Iowa who are here because they're concerned, gravely concerned, about the direction this state is headed amidst the coronavirus pandemic. Iowa is on the cusp of catastrophe, and we need to do everything we can do now to fight this pandemic before it turns even worse. Now, there is one major evidence-based tool that we are not using in the fight against the coronavirus, and that is a public mask policy. In fact, Iowa is one of only 2 states in the country that does not yet have a mask policy. So we have sent a letter to Governor Reynolds, now signed by over 300 physicians and advanced practice providers, urging her to pass a public face mask mandate. That letter was joined by other documents signed by leaders of 16 other healthcare organizations across Iowa that represent over 12,000 medical providers in the state, urging her to enact a face mask mandate. The scientific evidence is now convincing. Face masks work. And it's important that we all wear them because data show that up to 45% of individuals infected with this virus don't know it because they don't show any symptoms at all, yet they still remain contagious to others. So those not wearing a mask unknowingly infect and endanger the lives of others. These findings prompted the CDC to enact a recommendation on April 3rd of this year, recommending that the public wear a mask when in public. That was almost 4 months ago. And over those 4 months, the CDC and the Iowa Department of Public Health have engaged in public education trying to get the public to wear masks. Yet unfortunately, a recent poll showed that only 54% of Iowans are wearing masks in public. That's not nearly enough if we're going to get control of this pandemic. So if 4 months of public education have not been enough to compel the overwhelming majority of Iowans to wear a mask, what will? We propose that it's going to take leadership from our elected officials in the form of a law, of a face covering mandate. And there's evidence to back this up. There's a study that was conducted at the University of Iowa that showed that states that enacted a face covering mandate did in fact have a lower rate of COVID-19 spread. There is science behind our recommendations. This is not politics. And in fact, in my opinion, there should be no room for politics when we're discussing how to beat this disease. Now let's talk about exactly what we are prescribing. We recommend that the general public wear a cloth mask or a face shield in public settings where physical distancing of more than 6 feet cannot be consistently maintained. At a minimum, this mandate should apply to adults and older children who can medically tolerate a face covering while inside, indoor, or enclosed public spaces. Let me be clear about what we are not asking for. We are not asking that people wear a mask when they're in their backyard, or walking alone on the sidewalk, or driving in their car, or singing in the shower. We ask Iowans to wear a mask only when they are in danger of exchanging respiratory particles with another person who does not already live in their household. And that's about 6 feet of distance. Now, we acknowledge concerns that a mask mandate might appear to be in opposition of the personal freedoms enjoyed by Iowans. We contend, however, that due to the unfortunate prevalence of asymptomatic viral transmission, individuals who choose not to wear a mask endanger the personal freedoms of others. They do so by imperiling their life. I view a mask mandate as similar to our drunk driving laws. Yes, it says what you can and can't do, but it's meant to protect innocent people, and it may even protect you. Aside from health, I do think it's worth mentioning that mask mandates can be good for the economy. A recent Goldman Sachs analysis anticipated that a mask mandate would help support the GDP because it is clearly the preferable option to business closures and stay-at-home orders in a way to fight this pandemic. To some, the response to COVID-19 seems blown out of proportion. If one does not witness the wreckage of this disease firsthand, it might seem like an abstract or even fictional threat. But the medical providers you see here can attest that this disease is very real and it has the power to devastate an entire family. Last month, I lost a longtime patient of mine who'd been coming to my clinic for years. She was in her late 40s, always smiling, always full of joy, so kind. And every time she came for an appointment, she would bring a box of donuts from Hy-Vee and give it to our clinic staff. And I said, hey, you don't have to keep spending your money on donuts just to come see us. And she said, well, I got to do that. That way you'd have to be a hypocrite to tell me how I should be eating. About a month after I last saw her in my clinic, I got a call from her daughter who lives with her. And my patient was shaking with chills and was having a hard time breathing. So I said, get to the ER, call 911. In the ER, her oxygen level was 65%, and that's bad. She was immediately intubated and put on a ventilator in the ICU. And soon her kidneys failed, and then her liver failed, and eventually her heart stopped. She went into cardiac arrest and required 15 minutes of CPR to regain her heartbeat. After that, she had so much brain damage that she wouldn't wake up. And she spent another 3 weeks in the ICU, showing no promising signs of recovery despite trying every drug that even had the remote chance of working. The woman who I had known to be such a wellspring of life and joy was now a shell of her former self. And I had to do one of the hardest things I think I've ever had to do as a doctor. And I had to call her daughter and ask her if it was time for us to let her mom go. And so her daughter came to the ICU. She put on a protective gown and gloves and a mask. And she went in and hugged her mother one final time. And she came out and she said to me, I'm so alone now. She was my best friend and all that I had, and now I'm alone. Over 44,000 Iowans have been infected by this virus, and as of today, 872 of Iowa's mothers and fathers and daughters and sons and husbands and wives have lost their lives to this virus. COVID-19 is real. It's raging through every part of this state. And it's going to get much worse if we don't all as Iowans start taking this seriously. And that includes our elected officials. No, masks are not a silver bullet. But when you are in a war and you are fighting for your existence, you use every bullet you've got. I encourage all Iowans to urge their friends and family to wear masks in public. And I encourage Iowans to urge their elected officials to do the right thing and to enact a statewide public mask mandate. Thank you, and I would now like to welcome Dr. Brian Privet. He's an ophthalmologist from Cedar Rapids and president of the Iowa Medical Society.
Thank you, Dr. Bates, for your leadership on this issue. It was the actions of several individual Iowa physicians, including Dr. Bates, that inspired the Iowa Medical Society to call on the governor to institute a statewide mask mandate. The Iowa Medical Society represents over 6,000 physicians and medical students in Iowa. We do not have a left-leaning or right-leaning political agenda. Our purpose is to advocate for the health and safety of our patients. Physicians across Iowa are as politically diverse as the rest of Iowans. Although we are a diverse group, physicians view COVID-19 through the same lens. We see the worst effects of the virus in our ICUs, our COVID wards, our nursing homes, and our morgues. Physicians are also problem solvers. We train for years to diagnose and solve problems. We use science to solve problems in an objective way. We weigh the pros and cons of every treatment we recommend. Today, our message is clear. The benefits of wearing masks and mandating the use of masks far outweigh the downsides. We know masks can reduce the transmission of COVID-19, and we know this based on studies including a recent study by our own University of Iowa. Our letter to the governor last Monday was also signed by 14 other healthcare group organizations, which included nurse practitioners, physician assistants, and pharmacists. Our clinics and hospitals are open for business, and we want to stay open. We do not want to have to stop elective procedures again due to PPE shortages or testing shortages. Iowa went through this for 2 months, and the effects on our healthcare system were devastating. The best way to keep Iowa open, to keep our clinics running safely, and to reduce the spread of the virus is to institute a mask mandate across the state. Masks work. It is time for all Iowans to step up and wear a mask. Thank you very much.
Thank you, Dr. Privet. I would now like to welcome Lena Tucker-Reinders. She is the Executive Director of the Iowa Public Health Association.
Thank you for the opportunity to speak on this important issue this morning. My name is Lena Tucker-Reinders, and I'm the Executive Director of Iowa Public Health Association. We are a nonprofit, nonpartisan, statewide network of your public health professionals. We are dedicated to the vision of a healthy and thriving Iowa. Healthy and thriving go hand in hand, or in this case, mask on face. The COVID-19 pandemic, more than any public health crisis we've faced in our lifetimes, is shining a spotlight on just how much every person's health is intertwined, and that government action is required to ensure our collective safety and keep our society going. In order for Iowa to thrive, we need to control the spread of this pandemic. We are not doing that. Let's be clear. We don't have this outbreak under control. The number of people getting sick is not going down, nor does anyone expect that it will soon. Iowa has one of the highest rates of infection in the United States, and still we are one of the few states without any sort of mask mandate at the state or local level. Iowa is on track to be one of the next coronavirus hotspots, just as our kids and teachers are going back to school. Public health is critical for a thriving economy. Widespread use of masks and social distancing are critical strategies to control the spread of coronavirus, prevent death and disability, and restore our economy. Mounting evidence supports this, including the research conducted right here at the University of Iowa that both of my colleagues have already mentioned. And that research showed that states who implemented mask mandates saw a reduced transmission of coronavirus in as little as 5 days. And every day that went on, that reduction in transmission became greater. We can reduce the spread of coronavirus if more Iowans wear masks on a regular basis. We can help ensure that we don't reach the disease rates set by the Department of Education that would trigger potential school closures. We can ensure that our restaurants, small businesses, and essential services stay open and are not overwhelmed. We can do this when everyone wears a mask, but too many people are not. The governor does understand how important masks are to controlling the spread of coronavirus. That is why she is already recommending that Iowans wear masks. She has consistently called on Iowans to do the right thing, and I do thank her for being seen more and more in public, frequently wearing a mask herself. In recent weeks, the Iowa Public Health Association, the Iowa Medical Society, and 10 local public health directors have all asked Governor Reynolds to do the right thing. This morning again, we, your public health and healthcare communities of Iowa, are calling on Governor Reynolds to do the right thing. Support a mask mandate, ideally statewide, but minimally allowing local authorities to have local control. Masks are neither partisan nor political. Public health should never be partisan or political. Public health is about preventing harm, saving lives, and contributing to a thriving Iowa. Thank you.
Thank you, Lena. Now I would like to present Dr. Rossana Rosa. She is an infectious disease specialist in Des Moines.
Thank you, Austin, and thank you, everyone who's joining us today. My name is Rosanna Rosa. I'm an infectious diseases specialist here in Des Moines. During the first weeks and even months of the pandemic, I often felt hopeless. This feeling stemmed from not knowing what treatments could help those who had fallen ill with this brand new disease, from seeing so many die alone, from not knowing what else could help decrease the spread of the virus except to ask people to just stay home, while also hearing in the news about the devastating and heartbreaking consequences of shutting the economy down. After the barrage of cases seen in late April and early May, things seemed to quiet down, and the reopening started. But clearly, an average of 250 to 300 cases per day did not equate to controlling the virus. And so in July, we were back into peak territory, again averaging about 500 new cases per day. And these are not just numbers. Each case is a person, a parent, a grandparent, someone's daughter or son, someone's friend. These are people, some who go on to struggle for weeks to recover, some who may go on to deal with long-term consequences from the virus, and many who ultimately perish. This scenario, stuck in the first waves, with then dangerous plateaus in between peaks, and all the suffering that goes along with it, does not have to be our story. It doesn't have to, because we can correct our course based on what we have learned. And we have learned a lot about the virus over the past few months, both in terms of how to treat the sick, but also what we can do to decrease the spread of the virus in our communities. There's no silver bullet or magic pill. There's a combination of measures we can all take, and so each one of us can contribute to freedom from the virus. And among those measures is the use of face coverings in public settings. Now, I confess that I was skeptical about recommending masks to the public at large at first. With PPE shortages looming, surgical masks and respirators needed to be reserved for healthcare workers, and the role of cloth masks as mitigation tools was unclear. But here too, we have learned things that should guide our decision making. We have learned that individuals can start spreading the virus even before they show any symptoms, thus unknowingly infecting others. Lab studies have also shown that multi-layered cloth masks can block respiratory droplets, which are the main drivers of COVID transmission. Face shields have also been shown to be able to block respiratory droplets. Large population-based studies have shown that in countries where widespread masks use is the norm, mortality rates from COVID are lower. And here in the US, states where mask mandates have been issued have seen a decrease in or slowdown in the number of new cases. Finally, studies describing contact tracing efforts in routine real-life situations, such as the hairstylists in Missouri, show that infected individuals wearing masks do not transmit the virus to others. So, while face masks and face coverings are part of the tools that we can use, such as physical distancing, they are a tool that can help us bring down transmission of the virus to this minimum. But for this tool to work, we need for everyone to adhere to it. And a mandate from the governor is the most expedient way for us to get to that goal. Thank you.
Thank you, Dr. Rosa. And then our final speaker today is Dr. Michael Kitchell. He is a neurologist in Ames and a longtime pillar of the medical community. Dr. Kitchell.
Thank you, and thank you all for being here today. I do want to talk about security. We do know that the world changed 19 years ago on September 11th, when we lost 2,977 Americans in the terrorist bombings. all endured a change in our lifestyle since then. We have all endured long security lines. We have all allowed our luggage and our bodies to be searched by the government. So now we are faced with a new silent terrorist who is taking 1,000 lives every day in this country. And by the election day, we expect that we will lose 250,000 Americans to this terrorist that we allow and we enable the terrorists to spread this terror to innocent and vulnerable people. I would call on the governor to act now to bring more security to Iowans, to keep this terrorist from being spread by these enablers who are irresponsibly spreading this virus. So please join with me in urging the governor to give our Iowans better security from this terrorist. We need to have a mandatory masking policy now.
Thank you, Dr. Kitzel. That concludes our prepared remarks, and we will stay if any of the media has questions. Otherwise, thank you very much for coming today. Any questions from the media? Okay. Thank you so much, everybody. Really proud of all of you. Thank you. Thank you.
Thanks everybody for tuning in. As you heard, coronavirus is not under control. It's raging all across Iowa, and now doctors are calling on Governor Reynolds for a statewide face covering policy. And it's so important because it's our brothers, our sisters, and our non-binary family that's at risk from this virus. So visit staysafeiowa.org/our demands to learn more about what Iowa CCI members are calling for from Governor Reynolds to protect Iowans from COVID-19.